This is to welcome all of you to the first of the Sustainable Environment Institute's seminars, monthly seminars that we hold in the fall and in the spring here through the LA Community College District. And today we have a very, very valuable panel to share with you, and we are starting now promptly, and we will end at 12:30 this afternoon. So by way of introduction, I'll do a screen share and let you know what our topic is today. We're calling it Everywhere and Forever Chemicals, PFAS, what you need to know. And today you will know more of what this means than maybe you even wanted to, but it does show you what happens when you have chemicals that are released into the environment that do not break down. They are persistent, so persistent that they're called forever chemicals. The researchers that we're hosting today are from both Adventist Hospital, Dr. Johnston, and our two presenters from USC's Keck Institute are Max Ong and Xiwen Lei, and they are working with Dr. Schatzi at a lab at Keck. And you'll see that this research that they're doing has actually gained a lot of interest nationally, even with recent press coverage. The upcoming Sustainable Environment Institute events begin March. The next one will be Climate Anxiety on March 21st. We have our Earth Month Film Festival, and then on April 25th and May 16th, we have both climate literacy and medicine and agriculture. So as you can see, we cover many different thematics. But today we're very happy to have Dr. Brian Johnston from Adventist Health Hospital, who's actually been with us before, doing a lot of work that he does in the community in Los Angeles with heavy metals and other toxins that affect communities of color, that affect working class communities in a disproportionate way. And it's important to bring that out because all of these researchers today work closely with the issue of what we call environmental justice. And that is to say, to what extent are what we might call environmental bads disproportionately distributed on communities of color and on working class communities. The two terms that we should start with is the word toxicology, which is the study of toxic substances in organisms, and the word epidemiology, which is the study of health and disease in human populations. Our researchers today do both of these things, and you'll see how important it is to be able to see where and how the physical, social, geographic, even economic distribution of health and disease is very revealing about the way in which our modern society fails to deal with a lot of problems. This is the molecule in question, or one of them, and that has these interesting unpronounceable names of per and polyfluoroalkyl.
The average person. And it's not just the fires themselves that present dangers. Firefighters are frequently exposed to toxic chemicals, and according to recent research, even their protective gear may carry health risks. Stephanie Tsai went to San Francisco to look into so-called forever chemicals and their possible effects on these essential workers.
Tony Stefani spent more than half his career at Station 1.
It was nonstop, and you wanted to be able to go out and help people.
But in 2001, he was blindsided and forced into early retirement.
At the gym where I was working out, I started to urinate blood. Within a week or two, I found out that I had a tumor in my kidney and I had to have my kidney removed. So my doctor at UCSF told me that, the type of cancer I had is normally found in people that are heavy smokers or are in the chemical industry. I was neither.
But chemicals are part of firefighting, and chemicals can lead to cancer. According to data collected by the International Association of Firefighters, the majority of active duty firefighters aren't killed by fires, but by cancer. Over the years, awareness has spread about the hazards of certain flame retardant materials that, when burned, produce toxic smoke. More recently, a commonly used firefighting foam has come under scrutiny. It contains extremely high levels of perfluorinated chemicals, known by their acronym PFAS, or PFAS. They've been manufactured by 3M and DuPont since the 1940s, and they take so long to break down, they're called forever chemicals. They're in everything from non-stick cookware to raincoats. As a result, almost all of us have traces of PFAS in our blood. But researchers say firefighters are exposed to much higher levels, including in the protective gear they're required to wear. Stefani often had to handle the PFAS-laden foam that the industry is trying to find a replacement for. But not even he knew until recently that firefighting suits called turnout gear also contain a high amount of the chemicals.
Teflon is in between the moisture barrier and the thermal liner.
Teflon is a PFAS chemical. Battalion Chief Matthew Alba says for all the occupational hazards that can't be eliminated, PFAS in turnout gear can and should be. In a statement to the NewsHour, 3M said, global health agencies and researchers acknowledge the limited nature of evidence indicating
average person. And it's not just the fires themselves that present dangers. Firefighters are...
Well, does that? But it does. I'm sorry. It just automatically starts again.
Acknowledge the limited nature of evidence indicating that PFAS cause harmful effects for specific health endpoints. The Environmental Protection Agency recently proposed designating some PFAS as hazardous substances. Stanford researcher Mary Prunicki says understanding what dosage can lead to disease is key.
The life expectancy for fire.
So we can see that there is a complicated taxonomy. These articles are all posted on our website, seilaccd.net, and they are to supplement today's presentations. So you can see that understanding how to classify these compounds and what they actually have as impacts on the human body are very complex. On the left, you see things that you probably can't even pronounce, and on the right, you see things that we run into every day: gasoline, insulation, fuels, water purification. And yet you look on the left side, and did you know that water purification includes chloroform? So this is why living in a chemical society is what Rachel Carson warned us about way back in 1962 when she wrote Silent Spring and changed the course of environmentalism forever. These are just the common ways. When you look at these, one of the many ways of classifying toxics, you have the ones that my students learn at Valley College, that there's carcinogens, mutagens, and teratogens. Some of these have far-reaching effect into DNA and into embryonic stages. Neurotoxins, allergens, pathway inhibitors, that's what's used, for example, in rodenticides and some bromide rodenticides, and endocrine disruptors. The other thing that she mentioned at the end was the difference in exposure. It's very difficult to research those substances where the exposure is chronic, where the smaller doses over a long period of time, that is usually the time when industry says, well, then how can you prove it was our substance if this person for 40 years was smoker, for this person for 40 years lived downwind from a power plant? So when you have many possible insults to the human body and exposure is chronic, it's even more difficult to tease out the role of a particular substance over a long period of time. So that is why my students have to memorize this table. What are the factors related? What are the factors related to the exposure, and what are the factors related to the organism itself? That would be us. So what do you do with a chemical that lasts forever? Meaning that it's found then moving its way through all of the different Earth systems, through water, soil, sediments, organisms, the air, all from its common source. This is another reason why it's difficult to research forever chemicals, because not only are they everywhere, but you would have to then find at which doses or which quantities are they present in these different cycles. That is why we look at the products that contain them, and it is indeed really vexing to see that these are things we run into so commonly, like pizza boxes and microwave popcorn. The Keck School of Medicine study then got this, I think this came out from the Keck School itself, discussing the research that our colleagues here are presenting, and this article is also available for you on our website. This came out in Nation of Change, a reference to the same research being done here by our colleagues from USC. So you can see that they have attracted some attention, needed attention in the work that they've been doing right here in Los Angeles. There's also the problems of why is it so difficult for our regulatory agencies to keep up. The DTSC, that's California's Department of Toxic Substance Control, reports that there are 2,000 new chemicals introduced each year at the rate of 7 a day. And the EPA can only focus on one at a time. So only 2% of the compounds that actually get released into the environment actually get any kind of testing. Add to that the problem that regulatory agencies depend on business or industry itself to test its own products. And there's obviously a conflict of interest. That is why we have some products that you've probably never seen the light of day, and yet they did. This is a very recent article from the United Nations where the UN is chastising DuPont and Chemours in North Carolina precisely because of exposure to PFAS in the communities. There is a long story as to why is it that our EPA has become what maybe harsh critics would say a captive agency, meaning that it's more likely going to look at the interests of industry before it looks at the interests of the public at large. So here's 5 reasons why those studying the failures of the EPA have identified why it is that the EPA has in a sense, gotten cold feet in actually confronting business on some of these compounds. We have a complicated policy process in the United States. It's making sausages. Nobody likes the process, and it's policy that comes out the other end, as it were. And you can see that the assessment of risk, scientific data, and those identifications of hazards come before there is actually the debates over risk management. What can and should government do? And that's where it gets watered down. We don't make policy from pure scientific research. We temper that scientific research with other interests, including those of industry. So we have products that are innocent till proven guilty in the United States. It does not follow what is called a precautionary principle, more common, for example, in the European Union, where testing is done rigorously at the first stages of a new product's release. In the United States, we wait until something bad happens, and then you get those famous product recalls of that you might see, back in the day, full-page ads in the newspaper. They're recalling a pharmaceutical, they're recalling the detergent. So in our upcoming newsletter, we will try to fill you in on what we've learned today. And of course, what we have today is this. We're very happy to have this wonderful panel. The articles that you see below there are actually already linked, and I've just shown you their headlines. So with that, I'll stop the share and turn over the discussion to our guests. So I think that our colleague here, Max Ong, might be pressed for time. So we're asking him to go first. And then he has some slides to share as well. So I will, what is it, how I do remove my spotlight.
Great. Thank you. Can everyone hear me okay?
Yes.
Yes.
Great. So I will share my screen. Well, thank you so much, George, for this invitation. And I'm really excited to be here with you all today to talk about, a case example of how our center investigators are working to advance translational environmental health research to
the wrong screen.
What's that?
You're not sharing the correct screen.
Which screen am I sharing?
Your emails right now.
Oh, sorry. I don't know why it's showing. It's on this page, so I wasn't sure. How about now? Okay. Sorry about that. Yeah, so I'm excited to be here with you to talk about, one of our projects to advance translational environmental health to address PFAS health effects. So, as George had mentioned, a little bit of background on PFAS. I won't go too much into it since that was such a great overview, but these compounds are multi-carbon chained compounds with fluorine bonds that can persist in our environment for several months to years, and they can bioaccumulate across the ecosystem. And a little bit of history about these chemicals is that they were widely manufactured in the 40s into several consumer products. And then through ongoing research and compelling evidence of health effects, certain companies started to begin phase outs of some of these chemicals because of known toxic effects. But the interesting thing is, you started to see a lot of these products that said PFAS free, but really it was essentially misguided advertisement, because it's free of certain PFAS, but then there was a lot of replacement PFAS compounds that started to get integrated into these different consumer products. So in reality, we actually don't know how healthy those types of products are, or what type of risks they pose to human health. And more recently, we've seen increased action from the U.S. federal government, as in addition to different state agencies, to take action on recommending more stringent regulations on water contamination, as well as resources for increased research and biomonitoring to address this major issue that affects millions of Americans. So, as George showed you, this figure here highlights to you all of the various different kinds of products that we encounter on our daily lives. I won't go into too much detail, but because of this industrial manufacturing of all of these products, what we've seen is widespread contamination in various ecosystems worldwide. We've seen data that has detected PFAS in ocean systems, in rivers, and in various different drinking water systems. And sentinel organisms like dolphins have detectable PFAS in them. And it's even showed up in far-reaching places like the Arctic. So all of this environmental contamination has led to pretty major human exposure levels. So there's data from ongoing national health biomonitoring studies through the National Center for Health Statistics that basically show that nearly every American in the United States has detectable PFAS in their blood. And in addition to this, various studies of birth cohorts have also found that PFAS is detected in tissues such as placenta, as well as cord blood and breast milk. And so they also pose a major risk for early life development, early life exposures as well. So to give you a snapshot example of how large this problem is in terms of drinking water sources, this map shows you data that the Environmental Working Group has pursued, where they've looked at various different drinking water sources across the United States. And they've illustrated here all of the different sites that have detectable PFAS and is contaminating drinking water sites. And it exceeds over 2,800 known contamination sites. And the reason why this widespread contamination is so important is because there's increasing literature in the epidemiology studies and in the toxicology literature that PFAS can have toxic effects on multiple organ systems. It's pretty startling how many different target organ systems have shown signatures or toxic effects. We've seen ample and strong evidence of higher cholesterol being associated with PFAS exposure. There's evidence of vaccine efficacy or reduced vaccine efficacy related to PFAS exposure. And then metabolic related organ systems like the liver and kidney have also been important implicated targets of PFAS exposure. To build on this body of work, our center has published a lot of various studies, and I'm only highlighting just a few examples here, but our center investigators have explored the relationships between PFAS with neurobehavioral health. So we published a study looking at maternal depressive symptoms during pregnancy, finding that higher PFAS was linked with higher depressive symptom scores. We've also, investigators have looked at metabolic outcomes like type 2 diabetes or obesity in relation to PFAS exposure. And then in addition to this, we've also looked at cancer health outcomes too. We've found associations between PFAS exposure with hormone-mediated cancers, particularly in women, specifically ovarian and uterine cancers. And then other investigators have looked at PFAS with hepatocellular carcinoma as well. So all of this body of work really shows you the breadth of focus that our center has been taking. And we really have this diverse phenotype health outcome approach when thinking about PFAS health effects. So building on that body of evidence, our research team was particularly interested in assessing PFAS contamination, particularly in Southern California and in Los Angeles. So last year, our investigators received an internal research grant to address PFAS contamination by applying a multidisciplinary scientific approach. And I'll highlight some of those study goals momentarily. So this project is led by a team of investigators, including Dr. Lita Chopsy, myself, and then we have colleagues at the School of Engineering, Adam Smith, who is leading some of the new methods to monitor PFAS in drinking water systems and identify technologies to destroy and reduce exposures. And then we're collaborating with experimental biologists as well, Lucy Golden, to explore and dive deeper into some of those biological mechanisms of PFAS health effects. So a little bit of background on this particular project and why we're motivated to focus on Southern California, particularly East and South LA. So I'll walk you through what we've seen so far from publicly available data in South and East LA. So this map here shows you a few important key takeaways. So you can see on the panel on the left, the darker purple colors indicate neighborhoods that have higher scores on this environmental justice screener called Cal EnviroScreen. And what this means is that those neighborhoods have higher overall environmental pollution burden. On the panel on the right is the same neighborhoods in East and South LA, where now we're illustrating which neighborhoods, according to the percent of that neighborhood that are identified as Latino. So you can see here that there is overlap where communities that are higher percentage of Latino also have higher environmental pollution burden scores. Now, you'll see a lot of smaller circles, and these indicate the various different PFAS polluting facilities and industries that are located in East and South LA. So we have metal plating facilities, we have chemical manufacturing facilities, waste management, textiles. So all of these different sources, potential sources of PFAS pollution are very much concentrated into these communities. And in addition to this, we've done some initial outreach with the US Geological Survey, and they have published some publicly available data on a few exploratory analyses of tap water PFAS measurements, and those are highlighted in the bright red circles. So you can see here that already we're seeing initial evidence that there are specific households in these neighborhoods that not only have high PFAS contamination in drinking water systems in the surrounding area, but then they're also having to face tap water measurements of PFAS as well. So based on this project or these motivating factors, the main objectives of our project was to partner with local organizations to expand PFAS water contamination measurements. And then from these measurements, we would partner with community leaders to conduct report back of our findings to the local communities. And in that process, we would start to build collaborative work groups with community leaders and community-based organizations to conceptualize and think of health equitable solutions to prevent further PFAS exposure. In parallel to this, our engineers are developing new technologies that can help mitigate and destroy PFAS in different water system sources, particularly water reuse sites. And then our experimental biologists are conducting in vitro experiments that can help complement those epidemiologic studies to get greater understanding of specific and precise mechanisms of PFAS toxicity. So for that first objective, this figure here illustrates to you how we've been conceptualizing this approach of building relationships, building multi-directional communication with partners. So we've been doing communication with local healthcare organizations, local and state government agencies, as well as community-based organizations. And the idea here is that we can learn from these orgs on how to better conduct our studies and inform that science translation piece to the community. So just to give you a sort of snapshot of what we've been doing, we've done a lot of multi-sector outreach. So we've developed relationships with the California Office of Environmental Health Hazard Assessment. We've done outreach with the US Geological Survey. So those are like our government partners. And then we've done outreach with the Natural Resources Defense Council, who has been doing incredible work looking at PFAS water contamination in California. We've also been working in partnership with other smaller nonprofit orgs like the Water Insecurity Correction Coalition, who's been helping us do more community-based grassroots outreach with local community members. And to build on this work, we've done extensive science communication outreach as well. So we've been presenting latest findings of PFAS and metabolic disorders as well as cancer to broad stakeholder audiences, such as the Collaborative on Health and the Environment, as well as more support groups like this example here of Woman to Woman, which represents a group servicing women cancer survivors based on the East Coast. And all of this, foundational work and relationship building has also led to our center investigators being invited by prominent stakeholders, like this one picture, for example, where the California Attorney General asked us to attend a press conference with him here in LA to talk about and give expert information on the PFAS health risks. So that was also another example of ways that we're trying to better engage with the public. And then in terms of one specific example that, one of our guest panelists, Brian Johnson, is here today, is some of the outreach we've been doing with more local healthcare serving organizations like Adventist Health. We're starting to conceptualize what it looks like to do informative PFAS communication to healthcare providers. Particularly, I'm highlighting this figure here on the right, which is a recent report that the National Academies of Science, Engineering, and Medicine published on clinical guidelines for healthcare practitioners regarding PFAS exposure. So this represents a really interesting frontier where environmental health scientists and clinicians can sort of start to meet at an intersection of where do we take the epidemiological evidence and start to guide and move it forward into clinical practice, and find ways where we epidemiologists can communicate with clinicians on best practices to do exposure assessment of PFAS. And then you can see here in this chart sort of 3 different tiers of recommendations based on PFAS exposure levels. So this work is, it's very much still in its beginning stages, and I'm sure like over time, it will take more work to refine and fine tune these recommendations for vulnerable communities and historically marginalized communities. But this represents a step forward in how we can start to apply the epidemiologic research and start to make some day-to-day health recommendations for communities that are affected by PFAS exposure. So from this project, after we've started to build these relationships, we've been doing outreach, and the primary community-based portion of our project is to essentially do outreach with local communities and do a community-based sampling project where portion of our project will be to survey community residents to understand their relationship with drinking water, their perceptions of drinking water, and their knowledge of and understanding of PFAS and PFAS health risks. And in this project, we will be going to homes and collecting tap water, dust samples, and soil samples to try to quantify the various different sources of PFAS exposures that these community members might be exposed to here in East and South LA. And in addition to this, we're also going to be delivering water filters that are known to reduce PFAS contamination. So this is our attempt at trying to find a short-term solution to help ameliorate the PFAS exposure experiences that these community members are facing. And then the sort of the future step is that from this, we'll work with our community advisory board to integrate the information that we collected from the surveys and try to start doing tailored research translation to community members during our report back, and also working with communities to create outward-facing dissemination products that can be delivered to media organizations, government agencies, and decision makers, and advocacy organizations as well. And then from that research translation, we'll be working with our community advisory board and other stakeholders to propose potential intervention recommendations. So this could include proposing to adopt more wide-scale, government-funded water filters for affected communities. This could result in more focused efforts to try to identify sources of PFAS exposure. So like doing more biomonitoring and more exposure assessment in affected communities. And we would propose these recommendations to our stakeholders and work with them to refine those intervention recommendations, incorporating community feedback, and then communicating that to decision makers as well as advocacy organizations. And this work is also amplified by this grant that Sherlock received to complement this work by building these multi-sector partnerships. So, hosting educational town halls, meeting with the community action board, and working to propose these interventions. So I just wanted to do a shout out for this really great new project that Sherlock is leading as well. So in terms of additional future directions, I had mentioned that our engineers are working really hard to approach this problem from a systems level perspective. So Adam Smith is particularly interested in how PFAS contamination is affecting water reclamation facilities across LA and Southern California. So his lab is leading the effort to measure targeted PFAS and also all of the different untargeted PFAS that have yet to be quantified in water reuse sites, and then trying to model how their fate and transport will affect different water systems across Southern California. In addition to this, another engineering colleague, Dan McCurry, is leading the other engineering project focused on remediation of PFAS, particularly with the model of applying this towards groundwater recharge systems. And so his primary focus is to look at how different anaerobic processes could potentially defluorinate and break down the chemical bonds between those carbon and fluorine molecules, and essentially destroy PFAS and mitigate exposures in these water recharge systems. And the rationale behind this is because all of those water filters that I described earlier, that really doesn't quite address the problem of destroying PFAS. It just sort of redistributes PFAS into another media, into activated carbon or to some other waste product that we have to further pollute into our landfills or other destruction processes. And then finally, the mechanistic side, the toxicology side, this is a really neat study that our colleagues Lucy Golden and Ana Moretti Mira are leading, where they've developed this model system where they're essentially creating these organoid cultures that are resemblant of the liver. And what they're doing is they're taking these complex organoid systems and they're dosing them with different concentrations of PFAS and PFAS mixtures and understanding precise molecular signatures that are being affected in these liver organoids. And the idea is that in human epidemiology studies, we're very limited in our ability to understand the target organ systems because we're largely focused on observational studies, right? So we're looking at the health outcome or early signatures in the blood, but we really have a difficult time understanding what's happening at these precise target tissues. And so this study really helps complement those human observational studies and provides greater insight to help us contextualize the findings that we observe in epidemiology studies. So with that, I just really wanted to sort of summarize overall what we've done so far with our project. So at this moment, we've hosted some informational sessions with community members. Most recently, we hosted a town hall with 30 community residents in East and South LA to talk about our project to increase awareness about PFAS and health risks and the issue that's affecting PFAS water systems in LA. We've done outreach with community stakeholders, local community-based organizations. Our engineers have begun to develop the protocols for testing their measurements and their new technologies. And our experimental biologists have already started implementing some of those studies to assess PFAS toxicity. So we're really looking forward to building on this progress with doing, amplifying our outreach. And once we've done our household study, to then start engaging in these, report back meetings and getting feedback from our community advisory board. And then looking forward, it's going to be really exciting when once we have the data from those experimental models to start integrating that with all of the other epidemiology studies. And I think that can really help advance future risk assessment and help inform health protective interventions and policies. And with that, I just really wanted to close with one shout out for a future webinar that I'll be moderating with Dr. Anna Reed, who's a senior scientist at the Natural Resources Defense Council. So she's one of the major colleagues that we've been meeting with and brainstorming ideas on addressing PFAS contamination. And her colleague, Eric Orellana, we're going to be doing this panel to understand how they've approached advocacy and community partnerships. So this is, you know, an available webinar that I highly recommend, you know, if you have the time to come join and visit and engage in this discussion as well. So with that, I will go ahead and stop sharing my screen. And I think should we hand it off to Brian for now, George?
Well, you did mention, and we're very glad that of all of the people that are sharing in this effort, this research, both Dr. Brian Johnston and Sherlock Lee are actually here. So I'm wondering if Sherlock Lee would like to unmute, if there's anything that you are willing to share with us. We understand you do a lot of the community outreach work, and that is something that the Sustainable Environment Institute is very interested in. So anything you might want to add to what Max has shared with us already, feel free to unmute yourself, and we can put you in full screen, as it were, to let us know what are the challenges that are confronting your work when you do outreach in East LA.
So my community partner is not technically in like it's part of the unincorporated LA, so it's not in South or East LA. It's in Del Llama, down at Long Beach area. But the neighborhood, I'm like the community leader I'm working with, the community is affected by two federal designated Superfund sites. Those Superfund sites are basically highly polluted with environmental pollutants. So they have one DDT Superfund site. So actually that area is like one of the largest DDT production sites in the United history in the past. And the community leader I work with, she lives in the neighborhood, and she started feeling symptoms back when, like 30 years ago, living in the neighborhood. And then she started feeling sick and nosebleed, and then she reached out to the neighborhood, asking around, do you also feel like sickness? And most of the people living in that neighborhood are feeling sickness. So they invited Environmental Protection Agency to do the testing, but they were not like trying to find the results. So they tried their, like EPAs are trying to kind of manipulate the results to a sense that they don't show high contamination in the soil. And then the community leader started doing her own testing and start sending those results to researchers and to independent testing agencies. So that part really, like when they received their samples, they were like, what are we receiving from you? It messed up their machines because the DDT is so pure in their environmental samples that they cannot even test it because it's so over the roof. The level is so high. So that's how she started this grassroots movement, and then started this organization to basically focus on environmental issues in the neighborhood. So I'm collaborating with her to try to do more educational workshops and also try to co-write policy recommendations on PFAS testing and drinking water contamination. But one issue is related to that is that the neighborhoods are already facing so many problems from air pollution. So they're also having major roadways going through the neighborhood. So they have high air pollution levels, and plus the Superfund size, the high environmental pollutants. So drinking water is just an additional problem they might feel overwhelmed with. So how do we address and balance our research interest in the neighborhood versus their own life? We don't want to overwhelm them with stress. Is a critical issue, and also we don't want to because they already had their own daily work, so we also don't want to overburden them with our own research interest as well. So that's kind of two main takeaways I have since I started reaching out to them.
Well, thank you, Sherlock, for that contribution, because I always tell my students that they should consider a master's in public health, because the impression people have is that public health is lab coats and test tubes. And I try to explain to them, no, it's everything. It's GIS systems, it's sociology, it's what we have in the San Fernando Valley, promotoras, and those are Spanish-speaking Latinas. They go to Pacoima and they knock on doors and they look for things like lead paint. And so it's a very big field, and it's important for people to appreciate that it's also a very collective effort with different disciplines that come together in understanding and solving a problem. I also want to direct people to the chat, because the upcoming webinar that USC is hosting, Maxon webinar, is actually, Beth has put it there in the chat. There's a link for registering for that event, as well as the USC Advocacy and Community Partnerships, drinking water and PFAS monitoring. So there's a lot of links in the chat that people can use to further their outreach and understanding of what our colleagues at USC are doing. So that's much appreciated. I know that Max is pressed for time and might have to actually leave us shortly, but we are very lucky to have Dr. Brian Johnston, who has been with us in the past. So this is a really welcome return of someone who has contributed a lot to these SEI seminars when it comes to our understanding of the impact of such things as heavy metals in a community. And Dr. Johnston is a practicing physician at Adventist. So I want to highlight him. Let's see, add the spotlight there. And go ahead, Dr. Johnston, and fill us in on what your work is.
Thank you very much. I'm going to be very brief. I don't think what I have to say is as important as what you've just heard. I will say that I've been here since 1975. I've worked at this hospital, and I've been very aware of the environment, been very aware, particularly because of the lead problem with Exide, but also other problems such as PM 2.5, the particulate matter that all the diesel trucks and trains are producing, all of the other environmental problems that we have in this community. And the fact that one's life expectancy and health are highly predicted by one's zip code. It speaks to the impact of environment on health. And we are dealing with a number of social determinants of health, including the environment. I think this community is acutely aware of the fact that it's highly polluted. And I think they are unhappy with our level of recovery at this point. And I have to say, we as a city and as a county have not really gotten ahead of the pollution. It's there, it's getting worse, it hasn't been cleaned up. I think this collaboration between the community college district and the folks at USC is absolutely critical. And it's new. It's a new and different approach. I don't think that environmental health and I don't think that public health work in a vacuum. And the connection between community hospitals and projects such as this, between the community colleges and this project that USC is engaged in. It is a terrific model, and I think it has great potential. I think it has value for students, just educationally. I think it can be aspirational in terms of getting people involved more in science and in health and their own education. I think that this program speaks to, by speaking through the community colleges, speaks to a very vulnerable population, people who are struggling to stay alive and struggling to get an education. So I think it's a very a worthy group of people. I think they are inherently inclined to take action, and I think it's a very healthy development. And I'm delighted that all of the colleges of the community college district are involved and participating, and I hope that we can spread this circle of participation through this project. So I will leave it at that, and thank you.
Thank you, Brian Johnston. We're fortunately familiar with some of your work and how much you have emphasized the fact that in the community college system, our students, for the most part, really do resemble Los Angeles. We have the most diverse student body at the LACCD of probably any community college district in the country. And they do live in these communities that are highly impacted. I think that is what your work points to. And I think that what I tell my students when I push the idea of public health as an area of study is that it includes, well, to go back to the word epidemiology, it actually begins with a map that a certain Dr. John Snow in London tracing cases of, I believe it was cholera, maybe it was typhoid, and what he did was he started putting a dot on the neighborhood in London where all these cases showed up. And using that dot map, he was able to trace the origins to a water pump. And all he had to do to stop the epidemic was to take the handle off the pump. And that gave birth to epidemiology as the science we know today. So often this work does begin, interestingly, for those geographers, with a map. And you could see that we were treated to Max's couple of maps that he showed and how important USC studies are, for example, with particulate matter and with diesel fumes. USC produces a map every few years that shows new cases of asthma. It's a dot map. And through that map, they discovered or revealed that the closer a child lives to a freeway, within, say, a mile, the incidences of asthma are proportionally higher. So there's a link there, a very compelling link between the diesel fumes and the trucks and the traffic on the freeways and children's respiratory health. So all by way of saying that USC is actually does a lot of work in this area of how it is that diseases affect given populations, discrete demographic groups in the city of Los Angeles. And as you might know, we have our hands full. We probably are one of the most industrial cities in the United States, though people don't see us that way. We have the major port in the United States with Long Beach and San Pedro, and all of the impact that has from all the ships burning bunker fuel and everything else that they use to keep their ships idling. The rail yards at City of Industry and City of Commerce. These are all what environmentalists and epidemiologists call insults, insults to the human body, that these colleagues do the fine pointed research on which organs, what dose, which compound, how long, and you need that information if you want regulation. So that is why this work they do is so vital. I would like to now turn it over, actually ask our guests to add anything they might want to add now. I know that Max got a 15-minute extension, so he doesn't have to leave us immediately at noon. But anything you might want to add before we start entertaining questions that people will put in the chat, and Jal Bellenhorf will look at what people are asking and then share that with you. So go ahead and add anything we might have not explained enough. It's DDT, that one, LA Times has extensive research on the dumping of DDT off Rancho Palos Verdes. one of the only submarine Superfund sites in the United States. The other one being the Farallon Islands outside of San Francisco, which have 55-gallon drums full of radioactive isotopes. So it's interesting. We're so blessed that we have two Superfund sites that are not on land, but are in fact underwater. So that gives you an idea of how industrial this state actually is. Feel free to unmute yourselves, either Dr. Johnston or both of you, Dr. Ung, Dr. Lee.
Yeah, I mean, I'm just I'd be enthusiastic to answer any questions or like engage in more discussions on the project or what others have been learning. Perhaps could be really nice to spur more ideas.
And the good place to put your questions is in the chat.
Oh, okay. Because I know I was going to say, could I get another?
And maybe you can write your question in the chat. It will be easier. Otherwise, we might get the feedback from people's audios.
I have a question, George.
Yes, please.
Yeah, so it's Beth Abel. So I'm really curious, Brian, if you can talk, and also you, Max, if you guys can talk about what you have actually physically seen happening with patients or clients who are coming in for medical health. What kind of issues? And I know, Max, you talked a little bit about what you're seeing in doctors' offices, but I know, Brian, you've had some experience in hospital with that, and if you wouldn't mind sharing some of that information.
I'm happy to talk. I don't, it's difficult to attribute the disease state to the environment, just looking at the patient. So, but we are seeing a lot of respiratory disease. We're seeing kids with asthma. We're seeing kids with enlarged livers and fatty liver, which is known as well to result from PFAS exposure. When we first began to do ultrasounds of the liver, I thought that, and this is a number of years ago, that I thought they had not adjusted their ultrasound equipment properly, and all these people with fatty liver couldn't possibly be, couldn't be that prevalent. In fact, it is that prevalent, and I think PFAS is a partial explanation, though it hasn't been demonstrated, that we used to think of a fatty liver as coming from high fructose corn syrup or alcohol or other toxic substances. But now I think we should be looking much more closely about the role of PFAS in that area. I also think that the problems with preeclampsia, with pregnancy-induced hypertension, I mean, that is a known effect. We should be looking closely at that. I think what we need to be doing is training our physicians, and we've begun that. Dr. Chatsi did give a presentation at our grand rounds on PFAS. Most physicians don't really know much about it. And I think we need to train physicians to recognize the disease processes that are associated with PFAS. And I am delighted that this program that is going on at USC is using chemical engineers to really work in that arena. It's very encouraging to hear that. And I think it gives us all hope that there's a way to do that. I also think it is important for the people who live in this community to know that their concerns have been heard or are being heard, and we are responding in a way that is socially responsible. So I will step back and let the conversation go on.
Very good points.
Yeah, I guess I'll just only add that as Brian mentioned, it's really difficult to attribute environmental exposures to certain health outcomes. And so having a whole picture of different exposure sources, especially with PFAS being so complicated with consumer products, with drinking water, with indoor dust. So having that like comprehensive view of what these residents are exposed to, that can help get us a little bit closer to understanding more precisely where certain exposures are taking place and what the best follow-up in terms of like interventions and education should be.
I see questions in the chat from my colleague at Valley College, Claudia Hazenhudel, saying that all of these substances are found in so many common items. Phasing them out seems like a very challenging task, doesn't it? Indeed.
Yeah,
Indeed.
yeah. Actually, that's you know, that's something that policymakers are starting to chip away at. So the press conference I did with the California Attorney General it was actually it was the press conference on a recent bill that was passed. I think it's AB 1200, focused on restricting PFAS in food containers and restricting inaccurate labeling of PFAS free in different cookware and food containers. And more recently, Anna Reed, who I hope she'll touch on this in that webinar next week, but she's been working with helping advance some newer legislation on, I think it's reducing PFAS from like non-essential use products as well. So that's kind of a couple examples of ways that you know, folks are trying to address that problem.
Can
Actually,
I ask one more quick thing, you guys?
Mhm.
Yes, all that makes sense. I'm just trying to think, why are they in all the substances in the first place? I'm assuming they're cheaper to manufacture, and they have a certain function that is very convenient and great for us. So in essence, anytime you're trying to phase something out, you need to replace it with something. Do we have at this stage in the game safe alternatives that we could replace it with?
So I think some NGO groups like Environmental Working Group have been trying to approach this, like where they sort of show you like current products and then safer alternatives that we could use. So I'm not abreast to every, you know, alternative, safer alternative, but I know that folks are working towards that. And you know, I think those could be good resources to sort of attend to first. Yeah.
Right. Which is funny. I just saw Terry just put something in there. Those artificial turfs, right? With the drought, people are like, "Ooh, let's do this. Let's put this thing down." Not even realizing now you're adding yet another problem to the mix. So yeah.
That's what it's called, a crumb rubber. It's very popular with groundskeepers. And we actually did host a workshop at Valley College some years back with Department of Toxic Substance Control, which was to hear from people who are trying to turn what is anecdotal into some serious data. And that is the very high rate of certain kinds of lymphoma with goalkeepers, young goalkeepers in the area of Seattle up there in Washington State. That's what started the ball rolling. And yet, from what I've seen from the more recent environmental reports from DTSC, there hasn't been any serious challenge to this use of what is essentially tires that are crushed up, they become crumb rubber, and then artificial turf is placed in it, and it makes groundskeeping very cheap. It means you can use the field all year round. There's all of these advantages, though soccer players will tell you they hate it because it doesn't act like turf. But now we see that even these little tiny microscopic pieces of rubber get in people's eyes, they get into wounds, and then with that, the concomitant possible carcinogenic effects of what are in our rubber tires. Right? I also see that our district academic senate president Angela Echeverry is here. She has an abiding interest in this, particularly when it comes to heavy metals in water. I just want to give Angela a chance to ask anything. She's very keen on this. Community colleges working with toxicologists, with epidemiologists to research what are, I think, heavy metals. I don't know if Angela, if you can hear me, if you want to unmute yourself and raise this issue you've brought up with the SEI in the past, and that is what do we do to research heavy metals in water? She might actually not be. I don't
Oh,
see her.
hi.
Oh, there-
Yeah. Yeah, I'm actually trying to multitask right now, but yes, that is something that I've been really interested in, heavy metal exposure in household products and food and just certain in neighborhoods, and how can we actually get students involved in projects looking at exposure and to some of these heavy metals, and use it as a kind of a teaching tool for our students.
Yeah, I think this is definitely something I would love to strategize a bit more, and it would be great to design an internship program that students can be involved in this community-based sampling project. And I think I need to learn more about logistics and what time periods is a good opening window. Like, is the summer good, versus the fall or the school year? And so if folks want to follow up with me, I would love to, try to envision this in greater detail, and try to scope out what a project would look like. And we have a research coordinator who's starting with our team very soon, next week. And she's very passionate about outreach and engagement with community college students. This is something she's done a bit in the past. So I think the timing is starting to become, opportune to actually nurture something concrete, and think of a good collaboration we can do together in that space.
And I wanted to point out that Sherlock Leap actually shared with us in the chat a link to what is the California environmental map for PFAS. And that dovetails with the issue I was raising, that it's also a geographic problem. I'm wondering, Sherlock, you mentioned Del Amo, and because I said East LA, and you corrected me and said, no, where you're doing a lot of your research is Del Amo. Is that also where the famous or infamous Exide battery plant is located? And do you have any overlap with that particular disaster?
No, I don't work with that particular area research. Yeah, my PhD dissertation was on pesticide in Central Valley, and now moving on to PFAS. So that's kind of my two area of research. Yeah, I can talk more about pesticide and PFAS. Those are yeah.
So there's a question in the chat from Kayla, who wants to get advice. And since we still have you, Max, here as well, I thought we could get to this question before you have to exit. And it's, what is your advice on where to start monitoring for PFAS exposure? She works with Orange County Environmental Justice, and they have water quality monitoring program. They've been wanting to add PFAS on the list for testing. She has a few ideas about where to start based on existing industrial corridors, but any advice on where to ID point sources? Well, we got that map thanks to you there in the chat. Thanks, Sherlock. And how to begin those conversations with local residents.
Yes. So I'll give you a brief answer, and then we should definitely meet Kayla after, because we're actually starting to collaborate with one of our incoming PhD students is trying to host a community educational session on PFAS water contamination in Santa Ana, which is, I believe, in the OC. So in terms of point sources, I think like starting with the locations of those PFAS polluting industries could be a good start. So I think, Sherlock, you have that data on the locations, right? So we'd be happy to meet with you and share that data, and so can maybe help you prioritize which neighborhood to start with. I would also try, I mean, if you have limited resources, I would try to start where there's already a lot of data from the the UCMR drinking water system measurements, because that's kind of how we've started to approach it. It's like, we can only measure a finite amount of households in our study. So like we've mapped over the UCMR data with these point sources, and that's how we narrowed down which households to do the monitoring. But yeah, I don't know if you want to unmute and expand a little bit more on that discussion.
Yes, of course. Thank you so much for your time, and I'd be happy to follow up with anyone who wants to learn a little bit more on this. And yes, I think I was in contact with Nicholas about the Santa Ana.
Oh, okay.
So yes, definitely. Yeah. Overall agree.
There's a question from Darby Southgate. Have there been any cognitive or behavioral outcomes associated with PFAS?
Yeah, so that's a great question. So I recently published a study that evaluated higher PFAS exposure was associated with higher depressive symptom scores in women during pregnancy. So the behavioral outcomes are a little challenging because of the various instruments that are used to assess neurobehavior. It varies quite a bit between different studies. And there's such sensitive periods of vulnerability based on these types of outcomes. So like pregnancy is a vulnerable period for depression, but other windows might have different degrees of vulnerability. And then I have another study looking at PFAS and early indicators of infant neurodevelopment, so neuromotor behavior. And so that we're just starting to analyze the data. Happy to follow up once we learn more from those results. But there's a lot of very emerging information on this space. So there's certainly a bigger data gap in that in those types of outcomes. And speaking of toxicology, I'm also co-leading a study looking at PFAS exposure in an experimental rat model, and we're seeing so far that PFAS exposed rats have higher ADHD-like behaviors after birth. So we're seeing increasing evidence in the animal studies, and that's helping to contextualize what we see in the human studies as well.
And let's see if there's another question in there. I'm scrolling. A hierarchical model that takes into account environmental factors and SES demographics as controls. Would love to know more. So that's from Darby at Southgate, or Darby Southgate, and just thanking you for that filling in that information. I'm reminded that at UC Berkeley, Dr. Tyrone Hayes has been looking at a particular weed killer, atrazine, which is another persistent compound that does not break down over time, and showed that the genetic damage from it is passed on to as many as 3 generations in a rat study, where the 3rd generation pups, as they're called, had never seen atrazine, but its grandmother had. So there's another aspect then to toxic substances when they act on DNA. Is there anything in PFAS so far as your research goes, that shows that it lasts through generations, even when the exposed generation is two rungs up the ladder, as it were.
I can't speak on that at this moment, but it is an interesting concept. I think perhaps in our experimental rat model, in follow-up studies, we could look at multi-generational outcomes, but I'm not as familiar with the other literature for PFAS.
There's kudos on the map. Thank you, Sherlock Lee. It's important to really appreciate the spatial dimensions of these problems, what geographers call the spatial dimensions, the distribution of bads. That is where the issue of environmental justice really comes up as a central feature of that, whether it's particularly cases in the Central Valley where people's water, groundwater, is contaminated with pesticides that have been used for a very, very long time, and now beginning to show effects on farm worker families and rural communities like Dinuba and Modesto area, where people's water is no longer safe to drink, and in some cases actually have to have potable water trucked in. This is something that those of us who live in Los Angeles don't even think about. But for people in the Central Valley, the contamination of groundwater from agrochemicals is legion. I am wondering if you have any insights into agricultural chemicals, even in the what you might call residues in our food, but particularly for populations anywhere in California.
Yeah, I can talk about my dissertation. So my PhD advisor is Dr. Beata Riz, is a known neurologist and environmental epidemiologist. So my dissertation was part of her studies to look at pesticide exposure and Parkinson's disease in Central Valley, specifically in Kern, Tulare, and Fresno counties. And we have Dr. Riz has published many papers since 20 years ago on this topic, but my project was on more recently on pesticide and progression of Parkinson's disease. So we have seen not only those pesticides are causing Parkinson's disease, but also leading to worse symptoms. So I look at depression symptoms, cognitive issues, and motor functions among Parkinson's disease patients. So in California, the pesticides are registered. So commercially applied pesticides are registered. So there's a database for pesticides. So we use a GIS-based approach to estimate the ambient pesticide levels applied in residential and occupational workplace. And we screened over 250 pesticides, and it turns out 52 or 3 pesticides are associated with Parkinson's disease onset. And among those 50-ish pesticides, we have seen at least 10 pesticides are associated with 1 or 2 or 3 progressive symptoms of Parkinson's disease. So that was kind of my research. And then I was also looking at cost effectiveness of banning those pesticides versus having them around. So because one thing that EPA does is they do cost risk benefit analysis. So when they look at the cost of the banning certain chemicals, in my case pesticides, they don't take into account of the healthcare costs accumulated among the patients attributed to certain chemical. So they only look at the cost of the agricultural loss. So when they look at pesticide bans, so they consider what's the alternative pesticide that will be used that will increase the cost for the farmers and also increase the cost of management and training, all that. But it doesn't take into account of the human healthcare expenditures, and also it doesn't take into account the health effects in the cost measures. So my project was using some of the health economics methods they implemented when they evaluate healthcare system, but then in the environmental health domain. So that's kind of my project. Yeah.
That's I'm so glad that in asking my question, I had no idea you'd done your dissertation work on that. So that's very very important that you've shared that with us, because we often think of environmental problems as being urban, and we overlook the fact that in many rural areas, environmental problems, if anything, might be worse. The air quality in the San Joaquin Valley is worse than Los Angeles, and of course the water table, the groundwater aquifers are highly contaminated. That includes hydraulic fracturing for oil and gas, where they're allowed to pump what they call product water back into the aquifer. Why that's allowed, I don't know, but obviously then that water can only be used as to irrigate. Pesticides do, I think, belong to that large, interesting group called neurotoxins. So often farm workers that might go into a field that has recently been sprayed will show acute pesticide poisoning. That means a visit to the ER. It is highly treatable, and it's rare for anyone to die from that in an acute way. But then the question is, well, what about chronic exposure? What about organophosphates, organochlorides, pyrethrums, chlorpyrifos, nicotinamides? There's families of pesticides that leapfrog each other because, as Robert Vanden Bosch pointed out in Circle of, I think he wrote Circle of Poison, that if you want to declare war on any organism on Earth, insects are the worst ones you could pick. They will mutate, they will survive, they will come back in what he called resistance resurgence. So it is interesting, we still have this very industrial chemical approach to growing plants. We've seen have a difficult time finding the alternative in organic and in agroecology, and changing our agricultural methods so that they resemble nature and not factories, right? Well, Dr. Johnston, I'm wondering if in your work that you've done through Adventist, if the hospital itself has the kind of community outreach that you do through contacting community colleges and speaking directly to communities. Oh, you might have to unmute yourself.
Thank you. Yeah. Yes, we do a great deal of community outreach. We spend a great deal of time just getting people immunized for COVID and other things like that. There are serious problems that we're aware of. I will send you a copy of an interactive map that was produced by EdSource in 2018, documenting lead levels in school drinking water. And we have checked around in the community, and many of the schools in our area have very high levels of lead in the school drinking water. It's interesting to me that there has been almost no reaction from LAUSD that I'm aware of. I've been told that staff were told to run the water for 3 minutes or something at the end of the weekend to discharge lead in those waters. It turns out that the water in the mains from the water sources is not contaminated, but that the contamination occurs at the end source use and the drinking fountains and faucets around. One school in the Huntington Park area had a level of lead of 2,400 parts per billion. 15 parts per billion is usually reportable. 5 parts per billion is families are supposed to be notified. So I think we do have a significant heavy metal problem, specifically lead. I would comment also, you were wondering where the Exide plant was. I can tell you it is 3 miles from our hospital. And in the city of Vernon, and we're acutely aware of it. We do monitor blood lead levels, which is the standard practice. Nobody, to my knowledge, with the exception of Jill Johnston at USC has done other things. She looked at the baby teeth and studied them and found that there was lead exposure in the second trimester. But I think bone lead levels would be very helpful because you can accumulate a great deal of lead in your bones and have only transient elevations of blood lead. So this is not a popular idea with most public health people. They don't, and I think that people who are knowledgeable can see real problems for not doing it. But I think if you want to know what the burden is, the lead burden in the population, that is where you would look. The hospital is aware of these things. You know, we deal with the low birth weight and the pregnancy-induced hypertension and the liver problems that we're seeing. The problem is educating ourselves to recognize them and identify the sources.
Well, Brian and Sherlock, really, and also Max, who's had to leave us, really want to thank you for what has been a very, very educational, eye-opening discussion on our chemical world and our very chemical city, and the work that you're doing to get to the granular level of how does this happen, where does it happen, who does it happen to, and it's sobering, but it's also very refreshing to see how active the area of public health and epidemiology as well as toxicology are around what are really the very profound social problems in our state, in our city. A reminder that our next seminar will actually be held on March 21st. It's going to be on a topic we've looked at before on climate anxiety. So a lot of that focus will be on the incredible burden that young people face today, people like Sherlock, who've grown up with environmental crisis after environmental crisis, particularly the climate crisis, and how it is that people succeed or actually struggle to cope and process that very challenging, very vexing problem affecting the entire species. Also, I think Beth Zhao was reminding us that on April, during our Earth Month, we'll have a film festival online, and on April 25th, we'll have something called Make Your Own Weather. That actually has to do with agriculture and soils. It's a very wonderfully complicated discussion. And then on May 16th, we'll have something that the SEI is quite committed to, and that is embedding climate literacy into the curriculum. We want to do that from K through 12 all the way to graduate school. It should be an integral part of all disciplines. So our effort is to get climate science out of the STEM silo and to have climate literacy, something found in social sciences, humanities, economics, political science. And we're fortunate to have a lot of faculty who have attended today that do just that in their courses, even though they are not, how shall I put it, they're not in the STEM silo, so to speak. Want to thank everybody for being with us today, and reminding you that this was in fact recorded and it will be posted on the website. If you look behind me, that's us, and there'll be a tab that's called Teaching Resources, and there you'll see all of our seminars going back to 2021 with the recordings and the articles that complement or supplement the presentation. So all the articles I referred to at the beginning today, all 5 of them are actually already posted on that website. If you want to email Beth Abels or Zhao Bellenhorf or myself, Beth Abels has an easy email address. It's Abels, ABELSBH @laccd.edu. So feel free to contact us through our website, and we will do the best to share with you all of this work that we are very grateful to USC and to Dr. Johnston for bringing us up on what we should really know about PFAS in particular. So I'm going to stop the recording now. Voila.